Welcome friends and happy pandemic Thanksgiving. This is a time of year for us anatomy nerds to restrain our enthusiasm for the components of the turkey, which is going into the oven. And so this year, because I have just my bubble to tolerate me, I am unrestrained in my turkey fascia enthusiasm, and I thought we'd take this moment to learn a little bit about the subtypes of fascia in a turkey. So here we go. Gross out alert for anyone who doesn't like looking at turkey parts. This video is not for you. When we look at a turkey, here's a sizable beast here. We can already see, and I'll get it in frame in a moment, we can already see that the turkey skin moves over underlying layers, right? We can sort of move the skin around, and we can see that it's an important piece of skin's function to slide over underlying layers. And the reason for this, right, or let's see, the function of this is to allow for blood vessels and nerves to easily supply the skin with everything it needs. If we were to make an incision in the skin, this is the forearm compartment of a turkey, and the extensor compartment, we can reflect back the skin. And when we do it, let me see if we can get it in focus. When we do it, we see that on the underside of the skin, there is a pearly webbing that disperses light. And this is a loose connective tissue. It's not fascia per se, but it's a loose connective tissue which allows the skin to slide over the muscle fascia. Speaking of muscle fascia, when we make this incision and we look at the forearm compartment of the turkey, what we will see is a form of fascia covering the extensor muscles we call epimysium. And this is a channeling force fascia. This contains the fluid pressure of the extensor compartment when it contracts, and it channels the force of one muscle into neighboring compartments, thus helping the timing and coordination of muscles in this forearm extensor compartment. If you were to follow this myofascia down toward a joint, you'd see that it blends with the layers of connective tissue that support the joint. It blends with the tendons and ligaments and joint capsule, and thus every densification of fascia near a joint is just a conversion of those muscle compartments near the joint. So that is skin and myofascia, but the real treasure of turkey anatomy is the viscera. That's to say, the giblets of the turkey. And so when we look at a turkey, we have ourselves beautiful examples of visceral connective tissue. We have, for example, a turkey heart. So, we got that in focus here. When you look at a turkey heart, you can see a shiny muscular bit that blends in with a sort of tendinous, fatty bit here. And then you can see a bit of the rough muscle exposed on one side where it's been cut away. And then you can see the back side, which kind of looks like a flat, opaque surface. So you're seeing the convergence of lots of kind of connective tissue in the heart. You're seeing the rough part is just heart muscle. That's myocardium. You're seeing the smooth part of the heart, that's epicardium, covering the muscle. And then in the back, you're probably seeing, I'm not sure, but you're probably seeing some pericardium, some heart sleeve fascia in the back here that's interfacing the heart with the next thing down. But maybe that's diaphragm? Maybe the heart goes like this? I don't know. We'll see. So that's heart. Now you can look at all kinds of bits, but I gotta say the absolute star of turkey fascia anatomy is the neck of the turkey. So now imagine you've got a turkey walking along, doot-doot-doot-doot-doot, and you got the posterior and anterior aspects of the turkey, and you can kind of hold the neck in this position, get a feel for how this neck might move in the living turkey. You can see that the turkey neck is wrapped in a fairly densely attached sleeve of fascia. We may call this prevertebral fascia or axial fascia, but you can see it's wrapping the muscles and bones and other stuff of the turkey neck as we go. You can palpate in the back through this fascial layer some little spinous processes of the vertebrae. You can feel the articulations between the turkey segments. And if you look at where this fascial layer terminates, because of where the turkey neck has been cut, you can lift it up and you can see that this prevertebral or axial or investing fascia is covering some muscle. So we call this probably a form of myofascia here. Okay, now the most exciting part of this turkey neck is that you can see the relationship between nerves and turkey fascia. You can see through the pearly layer in front some white concentrations of fascia that are sitting deep to this sleeve we just talked about. That's probably some ventral sympathetic nerves that sit in the front of this turkey neck. And from the sympathetic nerves to the back, occasionally you will see a bit of a string that sits, that you can pull up like this from the front to the back. Now, I don't know, but this may well be a ramus communicantes, a communicating ramus from the sympathetic nerves in front to the somatic nerves in back, thus coordinating segmentally the autonomic responses of this bird. So that is a fascial relationship between two subtypes of fascia, the myofascia and the fascia that makes up this nerve, which is a branch of meningeal fascia, the fascia that wraps the brain of this turkey and has found its way into this tiny little branch sitting under my knife. So my friends, thank you for watching. Thank you for not getting too grossed out while watching. My apologies to my vegetarian house mates, and I bid you a very wonderful holiday. I hope we take this time to learn things about our own bodies, about turkeys' bodies, and we will see each other in the new year. Happy Thanksgiving, and enjoy your turkey or non-turkey centered meal today. Be well.